Hi, Harrison Vaughn here for cervicogenic dizziness. We get a question a lot about sensorimotor tests and are these applicable in the clinic? What is the meaning behind them? And there was a recent study that just came out, it's a case control study that looked at differences in 7 sensorimotor tests for individuals with idiopathic chronic neck pain versus asymptomatics. And really the authors didn't find any difference. And sometimes this can be somewhat disappointing to find differences, but really we want to know, decipher potentially why, and that's kind of where I want to stand here today to tell you. But generally speaking, when you talk about sensorimotor tests, and agreeing with the authors in their discussion, there's somewhat of a ceiling effect. Either it can be really, really bad, or small changes that may not be able to be picked up with potentially the test that we have, or it's just not relevant. And interesting enough, the population that the group used in this study was idiopathic and chronic. So these individuals did not have dizziness that I know of, and they did not have a traumatic origin. And generally speaking, when you look at sensorimotor deficits such as joint position error, things of that nature, usually the standpoint is that someone's going to be more likely to have that if A, they have dizziness, and B, if it's a traumatic neck injury versus a idiopathic or non-traumatic neck injury. And if you have both of those, then bam, there you go. You get a lot more probability of that occurring. And potentially these asymptomatics in this group, at least in the small group that they had, maybe they compensated with these other systems over a period of time that allow these systems not to be addressed with the test that we have. And it may come to show you if you took these same people and did potentially deep cervical flexors or endurance, or looked at deflection rotation tests or C0, C1, C2, C3, something of that nature, maybe stuff will pop up and that might be applicable to that person clinically. So the big thing I want you to get from this is, generally speaking, don't not do sensorimotor stuff, but don't be like, oh, everyone needs this. It's been around since 91 when Revel introduced it. I think here in the last like 4 or 5 years, it's really come around with more technology, with the lasers and apps and systems that allow for cool diagrams and stuff like that to trace. But that may or may not be necessary for these people if you don't have the basics down packed, such as the mobility, either hypermobile or hypomobile segments, pain-free movements, proper activation of certain muscles. And that's kind of where we stand. And with our physio blend that we teach, we really feel like, all right, you got to knock out A, B, and C, go address these other issues as they come, but they may not be necessary. Or if you want to do the sensorimotor stuff, that's probably a missing link of why someone's not getting better. And really, I think if you combine both approaches, which is what we talk about in our physio blend, combining manual therapy, therapeutic exercise, sensorimotor, vestibular training, you kind of get that entire package that majority of people that come to see me aren't getting. They're getting like a little piece of here and there. So it's a great article. I want you to read it. You can read more on our blog that we wrote up on it. But don't discount these sensorimotor tests, but just realize that it may not fit everyone that you see coming through your door. Thank you.